Sorry, there was a technical error. Very good afternoon and namaste one and all. Myself, Dr. Manisha Rana, welcome our respected dignitaries, respected GD members, respected Gurujans, and today's guest speaker, respected Dr. Pangla Murlidhar Bhatt sir. All the scholars, students, and social media viewers watching this session live. I welcome you all in today's glorious 99th webinar session, weekly webinar series, Gyan Ganga Knowledge Wave. To begin with, I would like to pay sincere gratitude and pranam to our mentors, respected Vaidya Devendra Trigunaji sir, President GP RAV, respected Vaidya Manoj Nesri ji sir, Advisor Ministry of Ayush, respected Dr. Anupam Srivastava sir, Director RAV, for their constant support, guidance, and motivation for the successful sustain of this webinar. Now, I would like to introduce today's guest speaker, respected Dr. Pangla Murlidhar sir. Sir is CRAV Guru from Bangalore, Karnataka. Sir is serving as physician at Sudhanya Healthcare, Bangalore. Dr. Murlidhar has completed his graduation from Gulbarga University. Sir has earned post-graduation in Chikitsa from Mysore University. He worked as lecturer in STM College of Ayurveda and Hospital Hassan. Later, Sir started his private clinical practice actively in year 2000 at Sudhanya Healthcare, Bangalore. He also served as a professor, visiting professor and HOD PG studies at Shri Kal Bhairava Medical College and Hospital Research Center, Bangalore. Now, I would like to request all the participants to turn off their mic and cameras to maintain the decorum of this webinar. And post this session, there will be Q&A session to resolve the queries. And now, sir, I request you to begin with the session and enlighten all the participants with the topic Management of Psoriasis and Ayurvedic Perspective. Over to you, sir.
भाई हमारे में भी स्पीकर बहुत धीमा है.
Respected Director Anupam Srivastava ji, all the senior faculty member of RAV and all the Gurujanas and all the CRV students and other participants in this webinar. I'd like to present some views on management of psoriasis and Ayurvedic perspective. So probably all are aware of that the psoriasis, the psora word itself is a scaliness, and asis is a itching. This is one of the distressing problem of the skin. It is grouped under the keratinizations group of diseases. Psoriasis is a skin condition involving genetic and immunological derangements. The causes of psoriasis is genetic factor, especially in the gene it carries from generation to generations. Role of cyclic nucleotides. So cyclic nucleotide play a role in the controlling the epidermal proliferations as well as keratinizations. In this disease, the process of cyclic nucleotide is so much that excessive productions of the epidermal cells will be there, with the nucleus present in the outer layer of the skin. And third one is arachidonic acid metabolism. This is a metabolic error which will be helpful for the creating a kind of inflammations in the epidermal layer, causing the proliferation of the epidermal cells. More and more production of skin will be there. So in normal course, usually once in 3 to 6 weeks, new skin will be, one layer of the skin will be shut down. Here in this disease, the more than 15 to 20 times greater productions of epidermal cells will be there. So shedding will be faster, and we can see the shedding very clearly. And some of the immunological basis immune reactions and the decreased immune system also play a major role in the formation of this disease. These are all some of the internal causes of the psoriasis. Some of the other triggering factors. Any injury can trigger the psoriasis, and also use of non-steroidal anti-inflammatory drugs like simple acetaminophen, like paracetamol or Dolo 650. That kind of tablet also sometimes trigger this disease. Some of the seasonal variations, especially in the cold season, this disease will aggravate, and summer it will decrease. The infections, especially in the upper respiratory tract infections and other infections, also sometimes triggers this disease. Beta blocker, most of the antihypertensive drugs that will trigger. That's whenever the patient comes, you have to ask, are they taking any beta blockers? Psychogenic factor, especially the stress, anxiety, tension, also triggers the skin conditions. And the diabetes. Diabetes, one of the metabolic problem that also triggers this psoriasis. How we are going to diagnose the psoriasis is purely based on the clinical features. That is, we call it as the very important Lakshanas. The confirmatory signs are candle sign, Auspitz sign, and also Kobner's phenomena. Whenever we itch in that area, the line, the new lesions will be formed. The clinical features are dry erythematous papule, silvery scale, and itching. So dry erythema, usually it looks like a scaly. Below that, if you see, there will be a redness will be there, erythema will be there. And silvery scale we can see up front, and the itching. These are all the main symptoms of psoriasis. The classification of psoriasis is, one is morphological classification. In that, chronic plaque kind, guttate psoriasis, exfoliative psoriasis, and the pustular psoriasis. This is depending upon the morphology. And another one classification is regional, which affects the scalp, which affects the face, scalp psoriasis, and face, eyes, flexular psoriasis on the extension and flexion area, scrotum, palms and sole psoriasis, and arthropathic or psoriatic arthritis. The first picture is the chronic plaque psoriasis. The erythematous, that is exfoliative psoriasis, more erythema is seen in other two. One is less prominent, other one is we can see the prominence of erythema, that is exfoliative psoriasis. This one is guttate psoriasis. The next one is the pustular psoriasis. Guttate we can see small, a kind of thickened lesions, slightly coin size, small coin size. Pustular psoriasis, in the psoriasis we can see the pustules. The scalp psoriasis affects majorly on the scalp. Sometimes it may come other areas, but majorly affect the scalp. Palms and sole psoriasis only affects the palms and soles. So we'll just briefly see what the line of treatment as per the modern parameter. Then we will come to our view. One is topical applications like ointment, cream, contain coal tar, ditheranol, corticosteroids like Topicard or prophesalic NF, vitamin D3 and retinoids. These are all just to soothe that area, majorly heal the cracks. Phototherapy, photochemotherapy, and systemic methotrexate, cyclosporine, retinoids. Methotrexate and cyclosporine, they are group of the immunomodulator and immunosuppressing drugs. So it brings down the immune reactions, usually given in skin cancers also, and rheumatoid arthritis, that kind of conditions also, that will be given. Now let us look the Ayurvedic perspective. All disorder which occurs over the skin can be considered under the heading of Kushta. It involves Tridosha, and 4 Doshyas like Tvak, Rakta, Mamsa, and Lasika. Major classification of Kushta is one is Mahakushta, Shudra Kushta. Many other classifications are there. For example, because Kushta is Aparisankheya, and many of the Shudra Roga also we can see lot of Tvak Vikaras. Hence, Charaka says, Nacha kinchidastihi kushtam ekadosha prakopa nimittam. Astitu kalu samana prakritiyanamapi kushtanam doshaha amshamsha vikalpaha anubandha sthana vibhagena vedana varna samsthana prabhava and chikisyata visheshaha. So according to the dosha amshamsha vikalpana, its sthana, vibhaga, vedana, lakshanas will vary, varna will vary, samsthana and prabhava. So Chikitsa also will vary. For the broader classification, it has been classified into Saptavidaha, Ashtavidaha, Dashavido, and Aparisankheyo. Aparisankheyavido Vabhavati. Doshahi Vikalpene Vikalpamanyaha Vikalpayanti Vikharan. So for the purpose, he brief and Charaka says about the Saptavida, Mahakushta, and Ekadasha, Sudrakushta. The causative factors, Charaka's view, the Virodhin, Annapanani, Dravas, Snigdha, Gurunicha, Vajatam, Agatam Chakti, Vegas, Chanyan, Pratignatan, Vyayamam, Matisantapam, Atibhuktva Nishevinam, Sitoshna Langana Aharan, Kramam Muktva Nishevinam, Karmashrama Vyarthanam, Dhrutam, Sitambu Shevinam, Ajirna Adyashinam Chaiva, Panchakarma Apacharina, Navanna, Dadi, Masya, Tila, Lavana, Amla Nishevinam, Masha Mulaka Pishtannam, Tilakshira Gudashinam, Vyavayam cha Atyajirne Anne, Nidram cha Vajatam Divaha, Vipran Gurun Garshayantaha, Papam Karmam cha Kurvata. We can say what these causative factors and other triggering factors as per Charaka's view, majorly diet, the Virodhi Annapana and Masha Mulaka Pishtanna, those kinds of diet. And the suppression of urges, like for example, Chardi Vega Dharana, may lead to. And also we can see the classics, for example, Rakta Pitta. That Rakta, when it's flowing, we should not stop that. And also Atisara, when it's happening, we should not immediately suppress. Purvameva, Natu Sangrahanam Deyam, Purvameva Atisarina, Vivadhamanam Pragdosham, Janeti Amayan Bahun. These are all some of the our therapeutic approach also. Suppressing or stopping that urge also may lead to some of the skin disease. Especially habits like, for example, Vyayamam, Garmashrama Vyarthanam, Dhrutam Sitambu Shevinam, or immediately after Ahara Sevana, doing some of the Vyayama. These are all some of the activities also. Genetic, Dushta Shonita Shukraha leads to the person who is having already Dushta Shukra Shonita. If they have such kind of disease, he may transmit that disease to the next generation. Some of the drugs and therapies, for example, Charaka said therapies Panchakarma Apacharina may lead to the skin diseases. Apart from that, as I mentioned earlier, some of the suppression of the when the dosha is moving out, we are suppressing automatically. That suppression itself may lead to skin disease. Sometimes other disease will trigger. For example, Prameha may trigger the Kushta like that. So Prameha has been mentioned after the before Kushta. So after Prameha, Kushta has been mentioned. And stresses. For example, we have Dashavida Papa Karma may lead to Papam Karmam Chakurvita or Vipran Gurun Garshayantaha. These all may lead to some kinds of Buddhvega, Atanka, and that may also trigger or may be a major causative factor for the skin disease. Here the Pururupa, Sparsajnanam, Atisvedo, Navaha, Vaivaranyam, Unnatihi, Kotanam, Lomahashyasya, Kandustoda Shramaklamaha, Vrananam, Adikam Shulam, Shigrotpattis Chirastitaha, Daha, Suptangatas Cheti, Kushta Lakshanam Agrajam. In this we can see, for example, Vaivaranyataha, Unnatihi, elevated patches, Kota, and Kandu. If, for example, Vrana appears, it faster. Shigrotpattihi Chirastitaha. These are all some of the prominent signs of the, especially the psoriasis is concerned. So, Dosha Anusara Lakshanas, for example, in Vataja, Rauksha, Shosha, Stoda, Shula, Sankochana, Tata Ayamaha, Parushyam, Karabhavo, Harshaha, Shavarunatvam cha, Kushteshu Vatalingam. Pitta, it is Daha, Raga, Parishravaha, Pakaha, Visragandaha, Kledas Tathangata, Angapatanam cha Pittakritam. Swaityam, Shaityam, Kanduhu, Stairyam, Usseda, Gaurava, Snehaha. Kushteshtu Kafalingam, Jantubir Abhishnam, Kledaha. So, the Kushta diagnostic parameter based on the above shloka, in Vata it's more of Parusha, Ruksha, Kara, Sankocha, Vidalana, Shava, Arunavarna, and Toda. Especially for the major three prominent symptoms of psoriasis, in this Vidalana is seen. Color changes like Shava, Arunavarna, Ruksha, Para, Karusha, these are all the symptoms of psoriasis. In case of Pitta, it is Raga, Daha, Parishrava, Puyayuktaha, Ushmadikyaha. Especially in the pustular kind of psoriasis, Puyayuktas are seen, and also intensive Raga and Daha, erythema will be dominated, and Shrava also will be there. In case of Kapha, Utsanna, Mandala, Kandu, Sthairya, Ghana, Gaurava, Snigdha, Shvaitya and Shaitya. Here Utsanna is elevated patches, Mandala circular patches, Kandu. Apart from that, the Shvaitya or Shaitya is seen in Kaphaja. So Ragata can be compared with that of erythema, this Pitta dominant Lakshana. Ussanna Mandala, elevated plaques, is Kapha predominant Lakshana. Vidalana, scaling, is Vata predominant Lakshana. Kandu, the itching, Kapha predominant, sometimes Pitta also. Rukshata, dryness, majorly Vata predominant. In case of Avarana, it can happen in Kaphaja also. So, to which we can compare? This is a rough, the people may vary depending upon other authors like the Shishruta's view, Vagbhata's view slightly may change. We will try to see the prominent Lakshana and we can try to correlate. So, in exfoliative psoriasis, lesions are spread all over the body. So, in Eka Kushta, it has been mentioned Mahavastuhu, Mahashayaha. That shows the extensive lesions, big lesions. Universal scaling and erythema is common in exfoliative psoriasis. So, color of the skin being black or reddish brown, and they say it is Masya Sakalopamam. Then Masya Sakalopamam resembles the fish skin, that is the scaliness. We can see fish skin slightly silvery scale. And in exfoliative psoriasis, we can see edema, hypoalbuminemia, and occlusions of eccrine sweat ducts. That is, we can say Asvedanam, Mahavasti, and Masya Sakalam. Asveda is the devoid of sweat because its sweat glands are affected. We can't see any sweat here. Gutted psoriasis can be compared with that of Dadru. That it's a small discrete papules, round or slightly oval all over the body, particularly trunk, arms, and thighs. So Utsanna, Udgata Mandala. Utsanna is raised or elevated, circular lesions. Papules are pinkish or red in color, very less or absence of scaling. So he says here Ragapidaka Atasi Pushpavat. Itching usually is a tropical country, it's very common. So itching along with the color also will be pinkish red in color. Next one, chronic plaque psoriasis. It's the commonest one. It can be compared with that of Chikitsa Kushta. Lesions are of a plaque varying in diameter between 1 to several centimeters. Here, Shava Kinakara Sparsha Parusham Kitibam Smatam. Shavaha, darkish color or blackish, occurring over the joint surface with erythema and silvery skin. He says Kinakara Sparshaha. Kinaha is Ruda Varnasthana. So that means when the wound is getting healing, Rudavastha, we can see it still superficially it may look like a scaly, but inside it's a redness we can see. Surface of the lesions is rough, resembling of healed wound, itching, and thickened lesions. And vrittam, ganam lesions are solid or forms. Remissions and exaggeration of symptoms will be there here. Relapse will be there. What he says here, prashantischa punar utpadyate, subsides and relapse. Scalp psoriasis. Scalp psoriasis may occur alone. Sometimes all over the body also will be there. So it can be compared with that of Darunaka, Keshabhumim Prapatade. Site of the occurrence will be on the scalp. The lesions are of thick plaques. Lesions are dry and itchy. The whole skull may be psoriatic with characteristics of discrete plaques. There will be cracks. The skull skin can be observed in layers. Rarely the scales are firmly adherent, dry and itchy. Palm and sole psoriasis. So this can be compared with that of Vaipadika, Panipada Sputana, Tivra Vedanaha. Palmoplantar lesions of psoriasis occurs alone or along with the involvement of other areas. Here in the Panipada Sputana, cracks and fissures in the palms and soles. Lesions are well defined, scaly, and surface often shows fissure. Because of the fissure, sometimes pain will be there in Vaipadika. Sometimes pain and bleeding observed. Some of the other also diseases like we can see, for example, Pundarika Kushta, in that pustules will be there, Paka will be there, formations of microorganisms will be there, Sidma Kushta. These are all we can do the comparison for the psoriasis. So we have to see the psoriasis prominent Lakshana, what we call as a Pratyatma Lakshana. Based on that, we can make diagnosis. Chikitsa of Kushta. Vatottareshu sarpir vamanam, sleshmottareshu kushteshu. Pittottareshu mokshaha raktasya virechanam chagre. Vamana virechana yogaha kalpoktaha kushtinam prayoktavyaha. Prachanamalpe kushte mahati cha sastam sirabedam. Bahutoshe samshodhyaha kushti bahusho anurakshata prana. Doshe atimatrakrite vayur अन्यान् बलमाशुः स्नेहस्य पानमिष्टं शुद्धे कोष्ठे प्रवाहिते रक्तेः वायुर्हि शुद्धकोष्ठं पुष्टिनम् अबलं विशति शीघ्रम्. So whatever the type of kushta we are going to make, depending upon the dosha lakshanas and the dominant of dosha, we are going to adopt the line of treatment. It's a common. It may be psoriasis or it may be other eczema like our Pama, Vicharchika. We are going to do the, depending upon the dosha predominance, we are going to take up the case. Hence, Vatottareshu Sarpir. So Vata predominance is Gritapana, Kapha predominance is Vamana. In case of Pitta, Virechana and Raktamokshana. In increased dosha condition, Shamshodhana. Palliative in case of the Alpa dosha or Madhyama dosha. Avoidance of causative factor, that is Nidana Parivartana. So drugs used for the Shodhana, Josotklishte Hridaye Vamnyaha, Kushteshu cha Urdhva Bhageshu, Kutajapala, Madana, Madhukaihi, Sapotala, Nimbarasa Yuktehi, Shitarasa, Pakvaraso, Madhuni, Madhukam cha Vamanani, Kushteshu Trivrta, Danti, Trifalacha, Virechane Sastya. In our clinical practice, we use a kind of protocol. One is Snehapana. Snehapana with Mahatikta Grita, Panchatikta Grita, or Gugulatikta Grita, or Mahakalyanaka Grita. This Snehapana selection for the purpose of Shodhana, for example, in case of Vataja, we may select the Gritas like Mahakalyanaka Grita, or if he has a Chinta Udvega is the causative factor, we may select the Mahakalyanaka Grita for the purpose of Snehapana. If it is Pitta predominant, we select the Mahatiktaka Grita or Panchatikta Grita. So if it is Kapha predominant, we may select the Gugulatiktaka Grita. And Abhyanga, after the purpose of Shodhana for the Vamana or Virechana, we do Abhyanga, that is with the Eladi Taila or Eladi Keram, Kutaja Taila. Kutaja Taila we would like to discuss more because that is the product from the Siddha that is popularly used. And Estimadu Taila, sometimes Dinesha Valyadi, Nalpamara Dikyanam, these kinds of Taila, we can use it for the purpose of Abhyanga. And Sweda should be Mrudu Sweda, or simple Bashpa Sweda will be enough, or sometimes simple Sthana itself is enough, because Kushta should not be exposed, especially the person who is having more of Pitta dominant Lakshanas, better not to do much of Sweda. For purpose of Vamana Yoga, we select the Madanaphala, Kutaja Bija, Nimba, Patola. Here we won't select the Saindhavalana will not be added. Nimba Rasa, Swarasa usually we add it. Sometimes Patola Bija and Madhu we are going to add for the purpose of Vamana Yoga. Sometimes we give the Churna Yoga, sometimes we give the Kashaya Yoga. If it is for the purpose of too much Utklishta dosha is there, we select the Madanaphala. If not, we will do it with a simple Kutaja Bija, Nimba, Patola. With that itself, we can do the Vamana process. For the purpose of Virechana, we select the Trivrit Leha, Nimbamrtadi, Eranda Sneha. These are all the two usually we give it, Leha form or the Taila form. Sometimes we give those who are not accustomed to this Taila or Lehiam. We select sometimes, very rarely we select the Ichabedi also. Some of the external therapies we do like Dhara, Shirodhara. Either we do the Taila Dhara or Takra Dhara or Kshira Dhara. Taila Dhara is usually Vata predominant, and if they are depressed, having anxiety, phobia, Manasika Vikara, we select the Taila Dhara. Takra Dhara in case Takra Dhara also you can make a selection. For example, Aragodadi Takra Dhara. It's good for Vata Kapha conditions, Pitta condition also. Mustamaliki Takradara, Kshiradara, Pitta conditions, as well as we can also select for the psychosomatic issues with the Bala and Lamancha, as well as the Jatamamsi. Kshira Kashaya can be prepared, and with that we can do the Dara. Sarvanga Dara, if lesions are extensive all over the body, we can prepare a Kashaya out of Aragbada, Daruharidra, Manjista, Sariva, Asana. Based on the conditions, we can make either plain Kashaya or Kshira Kashaya or Takkar Kashaya that can be used for the Sarvangadara purpose. Lepa Yogas, majorly Siddhartha Kasthana Churna. We usually recommend Siddhartha Kasthana Churna. First, the external application of any of the simple oil mentioned in the classics, or Eladi or Dinesha Valyadi or Nalpamaradi kind of Taila. Leave it for some time, then apply Siddhartha Kasthana Churna or any of the, some of the, depending upon the dosha. Usually we ask them to mix with the either Channa powder or Mudga Churna, mix it and mix it with hot water, make it cool and apply all over the body. Leave it for 15-20 minutes. Then take a shower. That external application itself gives a lot of relief. Depending upon the other conditions, we can do simple. If it is, for example, Strava is there, pustular kind of psoriasis, plain the kanji can be applied, or coconut milk can be applied to relieve the burning sensation, erythema, that kind of symptoms. The commonly used Kashayas internally, what we give is Aragvadadi Kashaya. That is popularly, maximum we use it Aragvadadi Kashaya in most of the psoriatic conditions. Patola Kataruanyadi Kashaya, when Pitta dominance is more, we select this Patola Kataruanyadi. Asanadi Kashaya, if you suspect some more of Kapha involvement, Kapha Medo involvement, and associated with Madhumeha kind of symptoms or Prameha, we select the Asanadi Kashaya. Guguli Tikta Kashaya, so this Kashaya usually take it if there is a more Kapha involvement and deeper thickened lesions are there with itching, there we select. Mahatikta Kashaya, good for Pitta, Kapha conditions of psoriasis. Mahamanjistadi, good Rakta Prasadaka also. Sometimes in stubborn lesions, we can give this Mahamanjistadi Kashaya. Commonly used Shamanaushidis are, one is Arogyavardhinivati, Gandhakarasayana, Trifalagugudu, Shivagulika. For example, Trifalagugudu, Shivagulika, when the thickened lesions are there, they are more effective. Kaishoragugulu, sometimes psoriasis associated with the Vatarakta kind of involvement, like psoriatic arthritis, there the Kaishoragugulu will be effective. Aragvadasava, Kadirarishta. In the chronic kind of things, the usage of Kadirarishta helps a lot. Sarivadhyasava, Putrakta Prasadaka. Madhusni Rasayana as a show after the Shodhana, so to recurrence, what Charaka says, administration of nourishing therapies. So we can give Madhusni Rasayana, Manibhadra, Gudam, these kinds of preparation after the Shodhana. As a Shamana also we can give it. The external application, I'll talk more about this Kutaja Taila, the preparation of this oil. This is prepared out of Wrightia tinctoria leaves. We do this product at our center. Brihan Marichadi Taila. When the itching is dominant, so there we administer Brihan Marichadi Taila. Sometimes itching, if it is more, you can leave it for some more time. Usually oil application should not be left in the body for a longer duration, more than 10-15 minutes or maximum half an hour to 1 hour, you can leave it. If you leave it for a longer duration, it's a problem. But if itching is dominant, at that condition, sometimes we can use this Brihan Marichadi Taila for a little longer duration also. It is very effective. Yeladi Tailam or Yeladi Keram, Nalpamaradi Taila, Durdura Patradi Taila, especially for the scalp psoriasis, is very effective. Jivantyadyamakam is very good for the Vaipadika, where Panipadas put on Tivra Vedana. This will be very effective preparations. And ointment like Kutaja, some of the wax-based ointment, that will be very effective, especially in the cracks and to moisten the skin. Let us talk something about this, the Kutaja Taila preparations. It's called Sri Kutaja, Wrightia tinctoria. This Kutaja will yield the milky exudations. When you cut the leaves or any part of it, some milky exudations will be there. That is the active component of this leaf. So what we have to do, we have to cut this into small pieces. Leaves, only leaves are taken, cut into small pieces. And we have shown in the right side, some green we can see. So usually we can mix with the coconut oil, equal amount of coconut oil. For example, if you take 1 kg of leaf, add 1 liter of coconut oil. Little more also, it's fine. So Suryapaki method of preparation, leave it in sunlight, turn on once in 1 hour or 2 hours. Then we can see the oil, maybe in a 2 to 3 days of time, the leaves become very crispy and the oil will be separated. Oil will get a violet color. And this is the final product, thick oil. So the ointment is prepared by using our Madhuchista. This usually we will recommend, for example, kapha lesions or vata lesions, we can apply directly. It's very strong. It can be given internally also. This is a Siddha preparation. Siddha preparation. In the market, a lot of products are there. 777 oil. And in the Kottakkal Aryaveda they prepare Ayappala Tailam. Ayappala is another name, a local name, Malayalam name for the Sri Kutaja. Another company also prepare this. So sometimes it triggers the pitta sometimes. Some people will get allergic to this. Hence, it has to be diluted with coconut oil. While applying, you can dilute it. Sometimes when you are preparing the oil, if you feel some other conditions like other skin disease or vata dominant, you can also add tila taila to that. Instead of 1 part of kutaja leaves and 50% of coconut oil and 50% of sesame oil can be, tila taila can be used. Usually in sesame oils, the color will be not so prominent, violet color will not be so prominent, but in the coconut oil, the color will become very violet color. So we can use this ointment after bath. When there is a dryness is there, scaling is there, you can apply after. The oil can be used before bath. We have seen many times people are not ready for Shodhana. Application of this oil alone will give a lot of relief to the patient. It's a kind of a Bahya Chikitsa. So Bahya is also kind of Shodhana. It contains some, probably some kind of alkaline ingredients, some properties related to Vishahara property, hence it can be used. Some of the cases I would like to share here. This man is aged about 60-65, suffering from psoriasis for the last 30 years and took lot of medications, including lot of external applications, but nothing was giving a relief. every day morning gets up, he has a lot of shutdown of his skin. He collects in bags. He himself used to feel a lot of frustration. So we did Ubhayatara Shodhana for this person, Vamana, Virechana, and periodically he underwent Virechana. Usually we have to frequently repeat the Ubhayatara Shodhana, at least once Vamana, yearly once Vamana, and yearly twice maybe Virechana. He sincerely followed and he got relief of symptoms. Slightly blackening is there, but rest of the symptoms disappear. Some of the few more pictures of this patient is there. You can see the front lesions. It's covering all over abdomen and also his forearm. The another picture belongs to him only. He was obese also. He was born slightly hypertensive and diabetic also. So after the Vamana Virechana, all these disease also disappears. He became slightly lost a lot of weight also. Hypertension became normal. The diabetes also became normal. And he had a visual errors. Visions were deteriorating. After the Shodhana, he also got back his vision. He says, I could not see at night. But later, after the Shodhana, he could have a good vision also. So frequently underwent, later no much relapse was there. Very small lesions, maybe 1 or 2 body area it was there, but he had maximum relieved by the procedure of Shodhana and Shamana. This is a case of a pustular psoriasis. So immediately after a course of Virechana, the other picture was taken. The swelling has reduced, pustules has come down, almost lesions are getting dried up. So the benefit of the Virechana we can see in this case. And this person was taking the beta blocker also. The antihypertensive drug triggered the problem. So actually he never had any psoriatic lesions. So after started consuming the BP medications, he started having the symptoms. So we have told him there is triggering factor. Either you can consult the doctors, change the BP medications, or maybe after purification that will reduce. The same thing happened after the cleansing, BP also reduced, and he is out of BP medication also. This is a kind of guttate psoriasis. So after Virechana, we can see the changes. So later she got treated completely. This is immediately after the Virechana, we can see the change here. The erythema has come down, the thickness has come down, only discoloration persists. This is a case of palm and sole psoriasis before and after treatment. So this lady, 60 plus, having too much of psychological disturbance, depressed, and he was taking antidepressant medication also. She sincerely underwent the course of Dhara and course of Virechana. Then we could see the change in her lesions. This is her back of her foot before and after treatment. The conclusion is, though psoriasis is considered as an incurable disease, it can be managed or cured at clinical practice by frequent Shodhana procedures and appropriate Shamana Aushadhis. Apart from the above, Sattva-Vajaya Chikitsa plays an important role. Many times what people say is once psoriasis occurs, it's genetically predetermined disease. You don't have any cure for this, you have to suffer lifelong. This is not so. As per Ayurvedic view, we can manage, sometimes we can cure also, especially the palm sole psoriasis, the scalp psoriasis, many of the other chronic plaque psoriasis, guttate psoriasis, sometimes they complete relief of the symptom. It never appears in their lifetime. And frequent application of Shodhana play a major role in the combating these issues. With this few words, I thank you for all you for patient listening. Thank you.
Thank you so much, sir, for such a knowledgeable explanation of the topic. Before we conclude our session, I would like to request all the participants, if anyone is having any query or any doubt, they can put their any request any participants, if anyone is having any query, you can raise your hands and ask questions to sir.
Hello, sir.
Hello. Yeah.
Very good evening, sir. My name is Satvir
Good
Godara.
evening. Yeah.
Sir, will you please describe the... Hello?
Tell me, I'm listening. Yeah.
Sir, will you please describe the...
Not able to hear you.
Dr. Satvir, you are
Hello.
not audible.
Sir, is leech therapy is beneficial?
Yeah, local lesions, leech will be effective. For all over the body, the Rakta Mokshana Siraveda will be beneficial. For the local, for example, local and stubborn lesions are there, you can do leech applications. It will be effective.
After Virechan process, we can use the leech therapy,
Yeah, certainly. Especially when there is a more pitta dominant Lakshanas, you can use leech therapy.
Okay, sir. Thank you.
Okay.
Any other participant? Anyone else who wants to ask anything or any query, any doubt is there? Or if anyone would like to share their views, you are free to share your views. So it is all there too. Sir, I guess there are no questions. I think this is the time to wind up the session. So before this, I would like to propose vote of thanks. It is an honor for me to have the opportunity to propose vote of thanks on 99th webinar of Gyan Ganga Knowledge Week, a webinar series organized by Rashtriya Ayurved Vidyapeeth. On the behalf of organizing committee, I want to express humble gratitude to the guest speaker of the day, Dr. Murlidhar sir, for the knowledgeable explanation on the topic management of psoriasis and Ayurvedic perspective. Thank you so much, sir, for such a deep and elaborated explanation of the topic, and you have really given deep insights to the topic. Thank you so much for sharing the ancient secrets with us. For example, the Stree Kurja Tel preparation specially, and there was beautiful presentation of clinical cases. So thank you so much, sir.
Okay.
We are truly grateful to you.
Thank
And
you.
now I would like to thank wholeheartedly respected Padma Bhushan Vaidya Shri Devendra Tribunaji sir, President, Governing Body, RAV, for his blessings and continuous encouragement. I express humble thanks to Vaidya Manoj Nesriji sir, Advisor, Ayurveda, Ministry of Ayush, for providing us his immense support and guidance. We are highly obliged to you, sir. And I also extend humble gratitude to Dr. Anupam Srivastava sir, Director RAB, for his constant support and guidance. And sir has always been a catalyst behind all the activities which all are happening in RAB. So thank you so much, sir. And I must thank the organizing team of RAB and the volunteers who work behind the scenes for their tremendous efforts to make this webinar a grand success. And I also thank Gurujans and the participants who are connecting with us constantly throughout the series in spite of their busy schedule, and thank you so much for the patient listening. Further, the topic and the speaker for the next webinar shall be shared with all of you very soon, and next time we are going to have 100th webinar of this series. So we are very enlightened also with this session also, and we are enthusiastic for coming sessions also. Thank you so much and have a great day.